Good Sunday morning and welcome to WGN-TV Political Report. I'm Paul Lisnick. Ahead of the new year, millions of Americans preparing to pay higher health care premiums, and that's because Congress failed to extend Affordable Care Act subsidies, which expire December 31st. House Speaker Mike Johnson called off votes for Friday, brushing off concerns from Democrats and some moderate Republicans. Some estimates say ACA enrollees will see premiums spike 114% next year. The Congressional Budget Office projects without the subsidies, more than 4 million people will go uninsured in the next decade. Joining me now, Congresswoman Lauren Underwood, a Democrat who represents Illinois' 14th district, has been working on this issue on Capitol Hill. Congresswoman, good Sunday morning to you. Thanks for being with me.
Hi, Paul. Thanks for having me.
Look, you've been a champion of the Affordable Care Act subsidies continuing and making tax credits permanent for a very long time. It didn't happen. My question is, moving into the new year without that done, is it even fixable or is it too late?
Well, House Democrats put forward something called a discharge petition, which is a way to force a floor vote. And we made a lot of progress on that petition this week. All 214 House Democrats had signed, and then we secured the signatures of 4 additional Republicans, which means that we will be able to force a floor vote on a 3-year extension of these popular healthcare tax credits the first week of January when we return back to Washington.
And I know Hakeem Jeffries, originally there had been discussion of 2, whatever, and then Jeffries said, no, we're going 3 or nothing. So he's put pressure there. Some Republicans have said, look, this is the Democrats' fault because this was made temporary to begin with during the COVID pandemic. Do you regret not looking back and making this a permanent subsidy at that time?
When I first introduced the Healthcare Affordability Act in 2019, we were seeking to make these healthcare tax credits permanent. I worked with President Joe Biden to get them signed into law in 2021 as part of the American Rescue Plan, and then they were extended in 2022 as part of the Inflation Reduction Act. At that time, we were really negotiating with one senator, Joe Manchin, and 3 years was the longest he was willing to accept, and so that's what became law. But from the very beginning, we wanted these enhanced premium tax credits to be made permanent because we understood the tremendous savings that the American families were experiencing as they were buying their own healthcare coverage.
The discussion here has to do with the fact that we're trying to keep the premiums down. That's what the subsidies are all about. But look, there's another companion problem here, which is just that the cost of healthcare is just way too high. What, if anything, is going on to address that issue?
Well, Paul, I want to clarify, this is not just about lowering costs, and lowering costs is very important, but it's also about making sure that the American people have health care because health care is a human right. And what happened was these tax credits are so popular, we've seen the lowest uninsured rate in U.S. history. And I don't want to let that fly past as if, prices go up. Like, that's not what this is. This is about everyone needs affordable health care. That health care needs to be high quality, it needs to be affordable, and it needs to be accessible to every American. And extending these ACA tax credits are essential towards that goal.
Let me have you address a really critical issue that's talked about all the time for people who follow this stuff, which is, of course, the Democrats' position we need these subsidies, lowers premiums and all of that. The Republican response is you just keep giving money to the healthcare companies, the insurance companies, the healthcare companies. We got to stop that. And their mission is let's give the money to the people. I've never quite understood that because even if you give money to the people, $1,000 or $2,000, aren't they giving it to the insurance companies anyway to buy their policies? And if they're not, how far is $1,000 or $2,000 going to go?
$1,000 or $2,000 is not going to get you very far when your premiums are over $10,000 a year, especially those premiums without the expanded tax credits. And so, there's a lot of proposals that I hear from my Republican colleagues as if the American people will simply be assuaged by $1,000 or $2,000 into a Trump-backed health savings account. But the American people understand the true cost of healthcare. They've been paying high premiums. They've been paying for expensive prescription drugs. They understand how much it costs to get a procedure. And what we are talking about are real, tangible solutions that are offering working families an opportunity to make sure that that budget can fulfill all those essentials. What we see across the 14th district, the community I represent here in Northern Illinois, is that families are literally making a choice. Am I going to pay this high utility bill, or am I going to pay for my prescriptions? Am I going to pay this healthcare cost for my kid? And I think that these kind of Band-Aid solutions that the Republicans in Congress like to champion are things that might sound good, but they have comprehensive health care. They and their families are insured, they are covered, they are secure.
Yeah.
And people who lack that type of security are not convinced by those types of Band Aid measures.
Let's talk about another group who may lack that security, because middle class people who don't qualify for these subsidies, they're also saying they can't afford the premiums and they don't even qualify for the help. Anything in the works for them?
So there are a lot of folks who have seen their costs go up because they have employer-sponsored plans. And since the Republicans passed their big ugly bill earlier this summer, which was the largest healthcare cut in history, cutting $1 trillion out of Medicaid, $500 billion out of Medicare, and they're refusing to extend these ACA tax credits, it's injected a lot of uncertainty into our healthcare system. And we've seen people with employer-sponsored coverage talk about how their deductibles are increasing, their premiums are increasing, their copays are increasing. All of us are paying more. We're also seeing local hospitals close, or they're reducing service lines. So PEDS units are closing, or OB units are closing, making it more difficult to access care. And then, of course, Illinois stands to lose the most nursing homes in the country because of the impacts of these dramatic Medicaid cuts. At the end of the day, we are in a healthcare system, and these types of backwards policies advanced by Donald Trump and House Republicans hurt American working families, period. And that's why Democrats are fighting so hard for the American people to have high quality health care.
So we focus a lot about the ACA, but there's something else that's going on kind of at the same time. I'm sure you want to speak to it. And that is these federal funding cuts are also hitting permanent supportive housing, PSHs, under HUD changes. That means risks to shelters, people's housing. Also a concern, right?
Yeah, I mean, I don't know how many ways that Donald Trump can yell at you and tell you he doesn't care about you. We saw him do it this week in the speech. We see it in the policy actions that they take day in and day out. They are cutting essential services that working families count on. We saw Donald Trump take the American people to court to avoid paying SNAP because he wanted families to go hungry over Thanksgiving. I mean, it's absurd. It is cruel. There's so much chaos. We don't like it. We're not going to stand for it. And I think the people are going to go vote next year.
Would you support an annual cap on out-of-pocket expenses if it did mean higher taxes or something like that? Because obviously, part of that is to make healthcare affordable as well.
Out-of-pocket expenses related to healthcare?
Yes.
With your healthcare plan, there are caps. And so if you visit healthcare.gov, you are able to shop for plans. You're able to view what that deductible is. So how much do you have to pay upfront before that healthcare coverage kicks in? And then there is an out-of-pocket cap. So that you will know with certainty how much you would have to pay
All right,
out of pocket if something unintended or unexpected were to happen.
Just a little time left, but I want to give you a chance to speak to Black maternal health care and racial disparities, such an important issue to you. Do you have an update for us? Any measurement of success?
Well, we certainly have seen a number of viral cases of Black women being treated terribly, having their pain denied, being turned away. And people are outraged. And that's why we have worked so hard to advance our Momnibus bill in the Congress. We're preparing to reintroduce it early next year. It's now 14 bills to comprehensively address every clinical and non-clinical factor contributing to our nation's maternal health crisis. These are evidence-based, data-driven interventions, and many of them are bipartisan. And we are calling on Speaker Mike Johnson to bring it to the floor right away because American families can't wait. We need to make sure that all moms have the ability to survive childbirth and spend that first year of life with their families. And too many moms are facing really horrible interactions in our healthcare system, or ultimately devastating preventable death.
All right, Congresswoman Lauren Underwood, thanks for your time. Hope you get some kind of break over this holiday because you're going to have a full plate when you get back. Thanks for your time. Have a good Sunday.
Happy holidays, Paul.
And
Thank you.
happy holidays. Merry Christmas to you and your family. Thank you.
You too.